Hello to all Georgia Regents University College of Dental Medicine page followers. My name is Dr. Mario Romero, and I am an assistant professor in the Department of Oral Rehabilitation at the College of Dental Medicine, and the aesthetic course director for the undergraduate program. I have for you today a shade selection tip that I hope you find useful for your everyday anterior composite restorations. So let's start with the first slide. The first thing we are going to do is to understand the VitaPan tabs. In the picture, you can see an A3 shade tab, and for now, what I want us to analyze is the color gradient that this tab has and ask ourselves, do composite resins, when expressed out of their container, have a color gradient? And the answer is no. Look at the higher saturation of color in the cervical third of the tab. This is a modified A3 shade and will not match our composite materials. The same thing happens to the incisal third of the tab. You can observe the area of high translucency and halo effects. Now let's look at the middle third. This is the area of the tab that composite resin manufacturers are trying to match. So this is the area we as dentists should use for shade selection. Once we understand the shade tab, let me explain the way I use the tab clinically and give you the reason why. We are going to divide this by steps. So step 1, look at the teeth or tooth you need to match. This should take no more than 5 to 10 seconds. The longer the time, the more chances for error. This has to do with the physiology of the eye and the way that cones work as photoreceptors. One of the best tips I can give you is to use statistics to your benefit. In a recent data analysis done by Glidewell Laboratories, 80% of single unit crowns are in the A shade range and only 20% for all the other shades. So, if you are trying to restore a single anterior tooth with composite, those 5 to 10 seconds, use them to see what A range do you think your tooth is in before you even select a shade tab. Now, you select the tab and compare it to the tooth. Here is where many dentists make a mistake. Look at the photo and tell me, which portion of the tab am I using to try to select the shade? Is this correct? No, it's not. You can see that the saturated portion of the tab will give us a false negative because it seems darker than the tooth. But if we place the same tab horizontally, things change. Look how now this shade tab matches the shade present in the middle third of the tooth. Same shade tab, same amount of ambient light, and same set of eyes. Another common mistake, dentists do this all the time, they place a tab side to side with the matching tooth. Look at the shadow created by the tab. This gives the natural tooth a darker appearance and a false negative. Compare this position of the tab with the horizontal position. Same shade tab, different position, different result. Finally, the upside down position, used by many dentists and one that creates mistakes as well. Since we are using the area of the tab that is translucent, it normally makes us select a darker tab and a false positive. One more time, let's compare this position with the horizontal position. And you can see that using the same tab and amount of ambient light, only the photo on the right actually matches 100%. I hope that you can apply this tip immediately in your practice and make a difference not only for you, but for your patients as well. If you don't know, I want to share with you information on our highly aesthetic anterior composite restoration hands-on CE course that will be held at the College of Dental Medicine Saturday, September 19th of 2015. This is a full day where I would share with you 4 hours of valuable information for the everyday aesthetic practice. And then you will restore a central incisor in our state-of-the-art sim lab following our step-by-step technique. Don't miss this opportunity that has limited seating and only comes around once a year. For more information, contact the Continuing Education Department calling free at 1-800-221-6437. One more time, 1-800-221-6437. Thank you and have a good rest of your day.